Breaking news right now, Indiana Governor Eric Holcomb is addressing Hoosiers on the state's actions in response to the coronavirus crisis. We're joining the governor's video conference live.
Executive order to reflect some changes and some clarification. And that order, this order currently today that's being put forward will go through May 1. And as I mentioned, there are some points of positive progress included in this EO and a couple of points of clarification. Those being after working with the Indiana Hospital Association and our 10 different health districts around the state of Indiana in regards to our supply inventory, our PPE supply line. We will be opening up the elective procedures front in a staged way, and I want to underscore staged way, so it's not all at once. But the first stage, starting tomorrow, Tuesday, hospitals could and should, in cases, conduct clinical procedures to diagnose and to screen and to treat medical conditions. Then on next Monday, April 22nd, if, and I underline if a few times, if our supply inventory holds up as it is now, we'll open up those elective procedures in other medical and clinical practices around the state of Indiana. And then just very quickly on the clarification front, nurseries and greenhouses and pet groomers can already be open. We heard some comments and received some questions about how, which we believed were addressed in a previous executive order, but we put out some further guidance, and that can be found at in.gov at the critical industries section. Just click on critical industries, go to in.gov. The reason, and this is the important part, the reason that we're able to take these steps and move forward on this front are twofold. One is you. You are practicing in large part good physical distancing practices, and you're slowing the spread, you're flattening the curve. We see this around most of the state of Indiana, not in all places, but in most of the state of Indiana. And then also your generosity. You have kind of rushed to those areas of need. You've met the demand and supplied to your local hospitals or local food pantries or local, just A to Z. The generosity and the Hoosier spirit is alive and well. And that has made a significant difference in where we find ourselves today. And then secondly, in addition to your very deliberate efforts, also our healthcare system or our network has just experienced some remarkable collaboration. And this has made a big difference, district by district by district, being able to meet the demand. And you know, we'll continue to practice our, or be in a safety first posture in the days and weeks and months ahead, constantly balancing the risk and the reward of every single decision that we make based on the science, based on the medical counsel, what we're seeing on the ground. Again, I say this every day, I believe, but we're going to let the cases and the numbers and the hospital admittance numbers drive our decisions. So we're not just pulling anything out of the air. We're actually looking at what's occurring in all 92 counties in those 10 different health regions. And so that's why we've dealt with, movement restrictions and making sure that we're not bumping into each other in large mass gatherings. That's why we're so appreciative to, over the weekend, we received a lot of input from the private sector, the business community, all different sectors of business, supplying us with, as we requested by Wednesday, April 22nd, close of business April 22nd, we requested, what are your new safe workplace environments and practices that you would put into place in your respective sectors? We're receiving those. That's very encouraging. And one thing that's just come through every conversation I've had is the reason why we are doing this, and that is employers care about their employees. And in most cases, it's like a big family every day when you come to work. And so that's been very, very encouraging. And then again, lastly, we'll continue to monitor what our capabilities are in terms of the tracking and the tracing and the testing. We're going to be able to, because of all these efforts, continue to care for, first and foremost, those who are in need. And then secondly, and equally important, get to the stage of reopening. Again, not flipping a switch and just going right back to the way it used to be overnight, but very methodically, very data-driven. And we'll get to that point to where we're back at work when it's safe to be there. And with that, I'll turn it over to our Health Commissioner, Dr. Box, for the latest on the land.
Thank you, Governor. Thank you so much. Good afternoon, Hoosiers. Today we reported 505 new cases of COVID-19 in the state of Indiana and sadly 7 new deaths. We're grateful to see the lower number of deaths reported, but I want to emphasize that sometimes we typically see a little decline in the deaths at the beginning of the week or after a weekend, especially a long weekend. So I don't want anybody to draw conclusions just based on that. Later this week, we'll be seeing some additional changes to our death counts because we'll be including our presumptive positive cases in our death total. What this means is that a physician actually listed COVID-19 as the underlying cause of the death for a patient, but there was no documented positive COVID-19 test for that individual. We'll explain more about this toward the end of the week and post that data. This will cause our death numbers to show an increase that's higher than what we've typically seen. But I want to make sure that everyone understands that these are not new deaths. Rather, we are capturing the deaths that have occurred really since this pandemic began and were now available to us so that we can, with that information, post them appropriately on our website. Indiana, like every other state, will include these deaths in our reporting in order to better capture the toll that COVID-19 has truly taken with regards to individuals who have become ill and then unfortunately died. This will give us a more accurate picture. I'd also like to provide a brief update on testing across the state. As you can see today, we reported 3,585 new tests, which is exciting to see, and it reflects the hard work that's being done all across the state. Last week, the State Department of Health actually tested 2,531 individuals at 4 drive-through clinics in Evansville, Fort Wayne, Gary, and in Sellersburg. This week, we're continuing drive-throughs in Gary, Fort Wayne, Greensburg, and Sellersburg Monday through Wednesday. Total tested through these drive-throughs has now been 3,777 individuals. I want to thank again our incredible partners who have hosted us in the local communities and provided logistical support and offered manpower through our local health departments and other community-based organizations. I also want to be clear that Indiana State Department of Health isn't the only game in town. We have hospitals, local health departments, Lilly, and many others who are doing incredible jobs making testing more available and more accessible. Marion County and Floyd counties in particular have been doing an incredible job in their communities by helping to bring more testing to people who are symptomatic. Testing individuals who are symptomatic gives us the best information so that we can do robust contact tracing. It allows us to ensure that those who are positive are at home isolating and that we can then identify individuals that have been in close contact with them and ask them to quarantine for the next 14 days. And most importantly, test those contacts if they become symptomatic. Finally, I want to provide some brief updates on our long-term care settings. As I noted last week, we've had a number of outbreaks and more than 100 deaths in these facilities across the state. We're working on a plan to provide weekly updates on those totals and hope to have more data to share on this front later this week. The Centers for Medicare and Medicaid Services yesterday issued a notice of their upcoming rule change that will now require facilities to notify residents and their representatives of the occurrence of a confirmed COVID-19 infection or the onset of respiratory illnesses among residents or staff. And this is something that the Indiana State Department of Health, from pretty much the very beginning, has required with our recommendations. These rules will also require regular updates so that residents and families have current information on the status of the facility and the conditions within the facility. Facilities will still be required to follow all privacy laws, but we believe that this move will help to ensure consistency and transparency across all facilities across the state. We also have issued new guidance for end-of-life situations to allow more facilities and families to be able to assist in the goodbye for individuals who are losing their loved ones. This applies even to loved ones that have COVID-19. Because of the unique nature of this coronavirus, these decisions should be made on a case-by-case basis so that we make sure that we don't unnecessarily expose someone who would be at high risk to get coronavirus. So for instance, a family member that would be at very high risk if they would get sick by saying goodbye to another family member. I want to encourage all of our long-term care facilities and our hospitals across the state to review this guidance and to have conversations so that families can have this last gift. Thank you very much.
Thank you, Dr. Box. Look, I just wanted to say before we get to the Q&A that I know the adverse effects of COVID-19, it's been rattling and it's been unnerving. It's had an effect on our individual and our state psyche and spirit and even soul. This is not unique to the state of Indiana. This is not unique to our country. This is happening all over the globe. And every day that we announce these numbers, those who have been infected and those who have regretfully passed on, we do that not out of choosing, but rather out of an obligation to make sure that you also are equipped with the facts so that you can alter your actions and your behavior accordingly so that you can be as safe as humanly possible. And so, setting aside those numbers just for 1 second, I just thought I'd ask you to focus on a couple other sets of numbers. One, and they give me a lot of comfort, quite frankly. One is 16,705. That is the total number of licensed physicians in the state of Indiana. Over almost 17,000 licensed physicians in the state of Indiana. 152,000, the other figure, 152,000 total nurses in the state of Indiana. So we're looking at an army out there who is on the front line. And when we talk about fighting this virus, this is that army who is not just talking about it, they're treating it. And
I've seen it firsthand, and hope that this year is no different and is the biggest year yet. And
Well, you've been watching Governor Holcomb's update on Indiana's coronavirus response. We're sorry for that problem there. The governor did officially extend the stay-at-home order until May 1st. We told you about that last week. 569 Hoosiers have now lost their lives to the coronavirus. And with 500 new cases, Indiana has more than 11,000 positive cases. We'll have a lot more for you. We'll try to get our signal back. You'll see that tonight at CBS 4 at 5 and 6, and right now on the CBS 4 Indy News app.
Who are also helping guide our COVID-19 response effort. And these are unique individuals in that Dr. Sullivan, who is the Secretary of the Indiana Family and Social Services Administration. Not only does she serve in that role, but then she also is going in weekly to Riley Hospital for Children and serving. Dr. Dan, who you've heard report on our nursing homes around the state of Indiana, is also a chief medical officer at FSSA, but he also practices medicine, emergency medicine at Eskenazi. Dr. Weaver, who works at the Department of Health, Lindsay Weaver, also practices at IU Health Methodist. Dr. Kaufman, who you see report on our EMS front on a weekly and if not daily basis, our state EMS medical director, he's also practicing at Ascension St. Vincent's. And then we've got Dr. Doss, who is practicing at in our Department of Corrections. In we remain so focused on that population, making sure they're safe and secure. So I just wanted to point out that these folks are not just talking the talk here, but they are walking the walk on the front line, as close to hand in glove as you can get to this effort. And so on behalf of all those that I've just highlighted, and there are thousands, as I just mentioned, like them, who are putting in as many minutes and as many hours and as many back-to-back days in this effort, 168,000 that I just referred to, we've all come together. And we're going to, while we're in this together, we're going to get through this together, and that's what at least helps me sleep at night. So having said that, we'll jump right to the questions and answer anything that's on your mind.
Sarah from WNIN.
Hello, Sarah. Good afternoon.
Hi, good afternoon. You hear me okay?
Yes, loud and clear.
Great. So we are reporting that a Spencer County clinic is administering antibody blood tests, and they've had numerous positive results for current infection of COVID-19. These clinicians say the tests are American made. How are results from antibody tests like these going to factor in to the process you're using to open up the state?
Me take that? Okay. So antibody testing going forward will be very important. It doesn't tell us anything about an individual's current state, whether they're infected. It's not like the PCR that we do for the nasal pharyngeal swab to tell us that somebody's actively infected. What it does tell us is whether someone is immune going forward, potentially, based on their antibodies. There's only been one test in the United States that has currently been approved through an emergency use authorization with the FDA. And that test is available. I'm not sure where it's available here in the state of Indiana. It may very well be the test that you're talking about. The unfortunate thing with some of these tests is that the antibodies are cross-reacting with antibodies, coronavirus antibodies for the common cold. So I would want to just be very cautious about which test this is and make sure that it is not cross-reacting. The other thing that we don't know about this test is how long does that immunity last? We know it probably takes a good 3 to 4 weeks for you to make enough antibody for us to be able to tell whether it's there or not, but to actually know whether that will be there in enough of an amount to keep you immune in 2 months, 3 months, 6 months, or a year. As you know, with things like influenza, unfortunately, we have to continue to re-immunize people on a yearly basis because of changes in the strains of the virus. Some viruses like HIV actually mutate, and they are not covered by an immunization or a vaccine because of the changes that they do. So in the future, it will be helpful for individuals who maybe were minimally symptomatic or asymptomatic and actually had the infection, when we're sure we've got that very valid test that's not only specific for particularly this SARS-CoV-2 virus, but also very sensitive at picking it up. I just don't know much about the specific tests that you're talking about, so I can't speak to that.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. Always good to visit with you guys on my scheduled 2:30 watching. So a couple of things. Dr. Box, Dr. Fauci, apparently on the Hill, reported today that he was concerned about a lot of the protesters taking place around the country, that people weren't social distancing, and this could possibly maybe spike our numbers 2-3 weeks down the road. I'm interested in your reaction to what we saw this weekend at the governor's residence. And Governor, for you, OSHA said so far we had about 800 complaints since last Monday. Any new numbers on complaints, cease and desist letters, or written warnings for businesses that may be violating those essential workplace orders?
So first of all, I respect the right for anybody to speak out and to protest, but I would in this time like them to social distance and to wear masks, because I am very concerned about those individuals becoming ill, or if they're asymptomatic carriers infecting someone else. So I just would like to see that done in a way that would respect the social distancing that is required.
Yeah, and Joe, you can come up here and let me just add to that, Abdul. This occurred in Marion County, where about a third of our positive cases have been reported and about a third of our total state deaths have been reported. And so it's an environment that appeared to be almost a perfect petri dish for how this can spread. And I underlined can, Don't know if it will, hope it won't. I think it has the potential unintended consequence of making your voice be heard. We respect everyone's voice and being able to step forward and be heard. But this would be the exact way not to be productive about that. Potentially, it just sets us back. Set aside how almost demoralizing it can be to those frontline people that I just talked about that go into work every single day and wonder if they're going to take it home. But when we just add to that, almost in a flaunting way, it is not helping. Now, there's nothing government can do to encourage people to care about their neighbors, folks that they may not know. But there are steps that can be taken, and I should say that just not more than about an hour ago, I got off the phone with a lot of other governors across the country, and the Vice President of the United States, my predecessor here in the state of Indiana, mentioned about just how important it is for these stay-at-home orders across the state of Indiana, the difference that they're making right now, and the need that we don't just pull up short. And I totally get the anxiety and the impatience and the desire to get back out there and get back out the way things used to be. There will be a new normal, and we will get there. And we're on the right path. That's the somewhat frustrating thing is, for the most part in the state of Indiana, we're on the right path. We just announced some progress. We spent all weekend working on responsibly and safely reopening. We want to do this in a smart way. And we'll get there a lot faster if everyone subscribes to the notion that we're in this together. And with that, Joe, I hope you remember the question that he posed.
I do.
Okay.
Joe Herons, General Counsel for the Governor. So the numbers that we have as of this morning, the aggregate numbers going back almost 2 weeks to the start of the enforcement effort that's being led by David Cook at the Alcohol and Tobacco Commission. The total aggregate numbers in various categories, I'll run through these pretty quickly. The number of complaints that have been investigated in the last couple of weeks is 982. The number of complaints that were determined to be unfounded or without merit is 866. The number of verbal warnings that were issued to businesses is 74, and there have been no cease and desist letters, no orders to close, and no referrals to prosecutors in the last 2 weeks. So those are the numbers.
Thank you.
Jake Thomas, Fox 55, Fort Wayne.
Good afternoon, Jake. Thanks for being with us.
Hi, Governor. How you doing?
Doing great. Thank you.
Okay, so this question is going to be for Dr. Box. Up in Noble County, the Sacred Heart Home in the Villa reported 3 new COVID-19 deaths this past weekend after one patient died and multiple others were tested 2 weeks ago. And we've already heard from one relative who says the facility is telling them very little information and they have to find out about these deaths through our social media channels. Could you tell us if the deaths were possibly connected to the first outbreak that happened 2 weeks ago and what the facility and strike team are doing to help cut down on the spread of this? And then finally, what can families do if they don't feel like they're being informed about what's happening inside these nursing home facilities?
So I'm sorry, I don't really honestly have those specifics in my head. And again, we want to report on aggregate data with regards to that. If our strike team has been in there, what they will do is go in and test anybody who is symptomatic. If those tests come back positive, we go back in and we make sure that we can isolate anybody who's positive, test additional individuals, sometimes symptomatic, sometimes asymptomatic individuals that we know are at risk to actually have contacted the virus. We'll test employees at that time. We make sure that, confirm that they have all the PPE that they need and that they understand what the infection control procedures are that we've discussed with them prior to that are, and we'll offer and do follow up with them. Then we have a team through Probari that actually calls the long-term care facility on a daily basis and follows up with how the individuals who are infected are doing, whether they have any more signs or symptoms with individuals that may be infected that we need to get back in and test. So we're very, very careful about that. With regards to families not being notified, I think that's really sad. I do think it is an obligation for long-term care facilities to let all of the residents know what's going on, and their families or their caretakers know what's happening. We're all concerned and very worried, and we can't see our loved ones right now. My own father's in a residential facility, and my mother-in-law's in a long-term care facility, and it's very difficult trying to get them to pick up the phone and answer, and they can't use a cell phone. So it becomes very hard on families, and I understand that personally. So I think the more information that we can give and the more transparent we are with regards to that, it's good. We do have to be very careful to protect the rights and the personal health information of individuals that are inside, but we can in general say that we have positive cases or that we've had a death or that, for instance, we have more people that look to be infected.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Adam will come back to you. Justin, the Westfield Indicator.
Good afternoon, Justin.
Good afternoon, Governor. My question is two parts. Firstly, what is the state of Indiana doing to ensure transparency in regards to the number of tests conducted at correctional facilities? Presently, only the number of positive tests, not the total taken, are reported. And secondly, what is the State Department of Health currently doing to address the outbreak of COVID-19 within the Westville Correctional Facility? Internal DOC briefings have shown that the number of inmates exposed to the virus may be almost 15 times higher than the number of confirmed cases.
Dr. Doss, you want to take a crack at both of those?
This is Kristen Doss with Dr. Doss with the Indiana Department of Correction, Chief Medical Officer. So up at Westville, we have had great partnership with the Indiana State Department of Health. They've come out, ran strike teams with us. And just as Dr. Box alluded, if we have positives from there, they come back out and help us with not only additional testing, but infection control practices as well. The capturing the full number is something that we continue to refine as we go. We definitely know who's positive. We do know who's negative. The toughest part is with staff because sometimes they go to their primary care doctor. There are also HIPAA issues there that we can't infringe on. So we are trying to be as transparent as possible. If there's additional questions, feel free to reach out to us, and we'll have our communications team get you the information that you can as able. Was there another piece to the question that I didn't answer? I'll take that as a no. Thank you.
Thank you, Dr. Doss.
Whitney Downard, CNHI.
Hello, Whitney. How are you?
Hello. Doing great. Hope you are as well. My question comes more about what those volunteer clinicians are doing. If we have updated numbers and if any of them were actually deployed. I talked to a couple friends who signed up but then never heard about whether or not they would be volunteering. So I was wondering if we had more information on that program.
I had the numbers last week and gave them, and I don't have them in front of me right now, but we have matched a lot of individuals who have volunteered. Now, what we were doing, though, is sending out a weekly email to everyone to find out whether they'd been matched, and if so, where they were working and what they were doing. And if they had not been matched, were they willing to work part-time or full-time? So there should be more emails following up for that individual to make sure that we do connect he or she, because we want all the help we can take. And it doesn't mean necessarily even having to go into the front lines with COVID-19. It may be for some of our retired individuals or people that have health conditions doing virtual visits over a monitor. It could be actually helping us with contact tracing through the State Department of Health. There are a lot of different jobs that don't involve direct connection with the community. So if she doesn't hear, please reach directly out to me, my email, and we'll make sure that happens. But we are reaching back to every individual through email.
Rob Burgess, the Wabash Plain Dealer.
Hello, Rob. How are you?
Good. How about you, Governor?
Great. Thank you.
Great. I wanted to second your shout out to Andy from Friday. Thank you for your hard work. I appreciate it. We heard the lower numbers, and that's obviously great news. But if the curve is flattening and the numbers of deaths start to go down, doesn't it mean the social distancing measures are working? And how can we truly reopen without a vaccine?
You know, That's very good question. Reopening will allow us to gradually open things up and have individuals be out in community with masks on, continuing their social distancing, but allows us to get back to being a productive state again and getting people back to work and to school, which is really important. However, that high-risk population, those people that we know are over the age of 60, have multiple comorbidities or underlying chronic diseases or infections, will be people that we may want to continue to have work from home remotely or continue to do more extreme social distancing, because really until we do have the ability to prove through antibodies that they have some type of immunity and we can really understand what that means, and or we have the ability to give them that vaccine, one that we know is going to work, and we're not expecting that till late in the year, we need to protect them.
Yeah, I would just add, Rob, that first and foremost, the reason for the stay at home, the reason for hunkering down was to flatten that curve, slow the spread. We've never said we're going to eliminate it on day 1 or 100 or 200 for that matter. But it's an effort to flatten the curve and slow it. And then when we do reopen, we'll do it smartly, we'll do it responsibly. We can and we will. And business as usual is a thing of the past. It will be different. And that's why I said at the very outset I was so encouraged by just the input that we received already. And this was just over the weekend, about how folks are talking about how the workplace will be different, whether it's telecommuting or whether it's the deep cleanings that are occurring at the beginning and the end of the day or the middle of the day, the breaks, the barriers that used to not be there, the washing of the hands, the wearing masks, all these things can happen. And the willingness on behalf of the employee and the employer will enable us to get back to work. It just won't be all at once or all of a sudden or in a responsible, unsafe manner. But we'll get there.
We return to Adam Wren of Indianapolis Monthly.
Hello, Adam.
Hello, Governor. Thanks for your patience. This question is either to you or Dr. Box. Vice President Pence said yesterday that if states around the country will activate all of their laboratories available, that we could more than double the testing overnight. Is that true here in Indiana? Are we getting closer to hitting the goal of 6,300 tests a day? And has there been any more conversations with labs like ARIA Diagnostics here in Indianapolis to expand testing?
So that simplifies it quite a bit, and it is not quite as simple as that. But realistically, yes, we are encouraging all of our labs to be engaged and all of our providers to engage all labs. I mean, LabCorp's turnaround time, I've had it documented, is much quicker now, like a 2 to 3 day turnaround. Quest Diagnostics is available. We have all of our Alverno, ARIA, Deaconess, Purdue's lab, all of these, Lily's lab continues to run a huge amount, and IU's lab. So we're utilizing all of those labs, and I want providers to use whatever lab is available to them to test individuals that are symptomatic for COVID-19. So we really can identify those individuals that are positive, isolate those individuals, and contact trace anybody that they've been in close contact with so that we can quarantine those individuals and then test them if they become symptomatic. We are absolutely engaged with every lab across the state of Indiana and appreciative of all the work that they're doing.
You want to touch on, he asked about ARIA separately and specifically, I think. You want to touch on that?
Sure. So I know there's been, I'm not on social media, so I don't see a lot of it, but a lot of talk about us turning down 50,000 lab tests from ARIA. And I can tell you, I have never turned down anything from ARIA Lab or from Zach Kahn. In fact, when we found out that he was so graciously donating labs to New York City, my chief medical officer and I actually reached out to Mayor Brainerd, who put us in contact with Zach, and we had a really great conversation. At that time, he said that occasionally he has trouble and runs short on viral transport media. We said that we were fortunate to have Lilly and now a subsidiary of Cook that was actually doing the viral transport media, but that swabs were an issue. And so he very graciously donated 2,000 swabs to us, which we were very happy to take. I think the actual terms that Lindsay and I used were, "You're our new best friend," and he delivered them the next day. So there's really no truth to that rumor, and I really would like to be able to clear that up.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon, Governor. Good afternoon, Dr. Box. Thank you for doing this. I'm sure it's getting a little tiring for you, but I wanted to ask Dr. Box a question about what are you hoping adding in presumptive positive deaths will show us? What is the idea of how we will enhance our knowledge of how the outbreak is going at the end of having those presumptive positive deaths in the picture? And one quick question, clarification about opening up for elective procedures. Does that include like regular dental visits, or is that still?
Why don't you take the first one and then we'll elaborate on that, Sherry. Here's next.
Okay. So Sherry, can you just restate your question just quickly for me?
The question was, what does looking at presumptive positive?
I'm sorry.
How is that going to change?
So it's important to me that, and to the state and to the nation, that we do capture individuals who lost their life because of this disease, because of this pandemic. In a clinical setting, oftentimes the ability to diagnose a particular disease, even like COVID-19, may be based on things that don't have to do with just getting a positive COVID-19 test. And that may be x-rays, it may be a CT scan, it may be the clinical picture. All of that goes together when a person is hospitalized, when a person is seen in the emergency room. The only difference is that if you document that positive COVID-19 test, especially for somebody who's released to home, then that allows me at the State Department of Health to get immediate notification about that test so that I can not only make sure that individual goes home and isolates, but then we can reach out and do an investigation with that individual to identify close contacts they might have had. So from a public health perspective, the positive test is important. There are individuals that occasionally will absolutely be a COVID-19 individual that lost their life. And we're confident of that, but the test may come back negative because we do rarely have some false negatives. So that's the importance of that, is making sure that we are realistically capturing every individual that may have lost their life to this.
Joe, you want to, Sherry, I could answer your second question with one word: yes, it does include. But Joe, you want to talk about not just Dennis, but the executive order, this new updated executive order, and the one previous, and how the language is just brought forward.
So approximately 3 weeks ago, the governor signed an executive order 20-13, that had a section in it entitled Conservation of Personal Protective Equipment, what we've been calling through this whole process PPE. And the idea behind the suspension of elective surgeries and invasive procedures for a certain category of providers and facilities, was to preserve that PPE for the surge that we were anticipating. So the same language that is in the Executive Order 2013 from 3 weeks ago is now in the new Executive Order, the stay-at-home order, under healthcare and public health operations. So those same providers are listed: dental, ambulatory surgical centers, plastic surgeons, dermatology offices. The same category of providers and facilities is listed. And between now and Sunday, there will be an evaluation based on the circumstances that provide that as of Sunday night, if everything is in order, those elective surgeries and invasive procedures could resume. And then there will be a mechanism in the executive order going forward in 7-day increments thereafter as to whether further easing would be possible under the circumstances and facts that we've been using throughout this whole process. And so that is essentially, in a nutshell, what we've put in the executive order for elective surgeries, and everything is looking positive for them to resume Sunday night, Monday morning.
Yeah. So you have a week, Sherry, to answer your question. Those folks have a week to get prepared for next Monday, now 6 days from now. Yes.
Dominic Miranda, WTHI.
Good afternoon, Dominic.
Good afternoon, Governor, and good afternoon, Dr. Box. This question, I believe, would be for Dr. Box. On the topic of recovery numbers related to COVID-19, many of our counties here in West Central Indiana have not reported many, if any, recoveries, quote unquote. Could you define what it exactly means to be fully recovered from COVID-19? And in that same token, Vigo County health officials said it's not necessarily the time right now to focus on recoveries, but rather the situations in our hospitals as we're still kind of in the midst of COVID-19 and in our hospitals with numbers. So my question would just be where we stand with recoveries and really just right now with the situation at hand.
I don't have the numbers that I presented last week with regards to our hospital systems and recoveries, but there were a significant number of patients that were discharged from the hospital and had not fortunately died from COVID-19. I think that what your hospital system is saying is correct. Right now, they're probably very much in the middle of battling COVID-19 patients and trying to keep them healthy as they possibly can and to treat them in the very best way possible. But we presented all of that information last week, and I can certainly get that for you if you don't have it. And we looked at all hospitals from all across the state that basically come in through our Indiana Health Information Exchange, and we put that data, Regan Street put that data together for us. So that would have represented anybody from Vigo County. The biggest problem with recovery is that there are so many individuals out there that may have fallen ill but had mild illnesses. That 80% that we know just kind of stayed home until they were better and waited till their fever went away, their cough got better. And so those are recovered patients. I don't know if you heard Dr. Yoletti talk, but even 3 weeks out, 3.5 weeks out, he was still feeling pretty exhausted and run down. And it takes a while for individuals to get better. So it does take a 3 to 4 week period of time to get through your symptoms and then to get better. And we did have some numbers last week specifically, which I just unfortunately don't remember off the top of my head today.
Yeah, Dominic, we can pull those 2 or 3 slides from the presentation last week and send them your way.
Jenny from WTHR.
Hello, Jenny. Good afternoon.
Hi, Governor. Thanks for taking my question. Appreciate it.
Sure.
I had a follow-up to the nursing home and long-term care facilities topic that you had brought up earlier in talking about increased transparency. We are also hearing from so many people, unfortunately, who have loved ones in a nursing home or long-term care facility telling us they don't feel they're getting the information they need from that particular facility. You had talked about some increase in transparency coming up in the next week or so. I know some other states, including Florida and California, are specifically publishing the names of facilities with outbreaks. No names of people, but names of facilities. And that's not happening here in Indiana now. So I'm wondering why Indiana is not doing that same thing and whether that will change so that families have the information they need.
So again, the plan is to give you numbers of facilities in an aggregate, the numbers of deaths and numbers of infected individuals. I have seen that happen. I'm sure that is something that we can consider, but we've really tried to avoid that because we do think that this is a personal thing between the facility and the individuals who live in the facility and their families. And I know specifically having a loved one that is ill that we've been able to call every day and get information on how she's doing and the ability to have someone actually, help her try to talk on the phone with us and other things. So I would hope that that's what's occurring. I think that as these CMS regulations and rules take effect, if it's not, that's part of what my regulatory division does, and we can certainly partner with individual families to look into that further.
Victoria Ratliff, the State House File.
Hello, Victoria.
Good afternoon, Governor. My question is for Dr. Box. So some health experts, including Dr. Fauci, have said that the key to safely reopening the economy is more widespread testing, including just testing people who aren't symptomatic. How close is Indiana to reaching that, and what do we need to get there?
So that's an excellent question and something that I've actually worked on over the weekend and will be continuing to work on this week. The tests are there. The ability to run these tests through labs are there. I think that the missing factor in some areas of our state might be the ability to actually go in and have that provider do the test because of the need for having the PPE. So I've actually reached out to the Hospital Association, and we'll have a meeting in the next probably 24 to 36 hours with them to see how we can actually get a handle on exactly where across the state all of this testing is occurring, map that out, map out all our federally qualified health clinics and community health clinics that are engaged and just now starting up to do this testing, and then identify those gaps within each county so that when I contact trace someone and I call someone, tell them they've been exposed to COVID-19 and they call back in 24 hours and say they're symptomatic or in a few days, we will know based on where they live where we can send them to get tested. So I think it's more about maybe identifying those sites and making sure that individuals are aware of where they can go to get that done.
Cassie Garrett, Whitewater Publications.
Hello, Cassie.
Cassie, you should be able to speak. We'll come back to Cassie. Eric Berman, WIBC.
Hello, Eric.
There it is. Hello, Governor. Going back to the question as we move towards coming out of this and lifting restrictions, I believe today with the elective procedures is the first time we've moved more loosely rather than stricter. Once there's a broader lifting of the lockdown, even in a partial phase-in, what does the state do to keep people from being like Henry when he's let off the leash? There's a little bit of lifting and everybody just floods the streets and floods gatherings again. What can the state do to prevent that?
Well, that's what I've talked about, it being a rolling or a very methodical, obviously a very responsible. In some part, it'll have to do with all the recommendations that we've received for folks telling us that they can conduct business differently. But again, it won't be all at once. It will be incremental steps. And yes, this is progress. This is a step in the right direction, but it's a responsible step because it's tethered to the numbers. It's tethered to what we can do right now. It's tethered to a sector that is very safe. Dentists are used to being good on the hygienic front. And so these are the types of steps that we'll take. And as we look at all the different sectors out there from A to Z, and what I'm referring to is whether it's sporting events or casinos or education or manufacturing, large or small, retail, we see this occurring around the country. Not everyone, but a lot of folks are looking at May sometime because we're seeing glimmers of hope around and progress around the country. I will say that, I've seen some other states say we're going to start to open retail business. That's true, but we've been doing that curbside. And so some states are just getting to that point of curbside retail business being open. And so we'll look at shopping malls, we'll look at theaters and museums and construction, et cetera, A to Z, and come May 1st, we'll be in a position to start to put a little more detail on that plan going forward. But again, it will be tethered, directly linked to the facts on the ground as they are on that moment of time.
Nikki Kelly, Fort Wayne Journal-Gazette.
Hello, Nikki. Good afternoon.
Hello, Doug. I was wondering if Dr. Box had any statistics on hospital admissions. It's one of the items that we need to be watching for to see if we have a 14-day decrease, but you don't have that up on the dashboard. So are we seeing a decrease every day in hospital admissions?
We did not over the weekend, so we can't say that that's happened necessarily. So that's what we're really looking at, though, is admissions to the hospital. We're looking at the usage of our ICU beds and our ventilators across the state. Now, the ventilators and the ICU beds is up I guess there's not a specific number about hospital admissions, but we can certainly, now that we have the data rolling through iHigh and Regenstrief, see if there's not a way we can't actually graph that for you. I know that my data team looks at this and watches this every day, so they'll be working on it before I finish.
Dr. Kaufman, you want to add something? You look like you had an epiphany there.
No, I just wanted to try to add some additional data to the discussion. I think that as you look at data from hospitals, and not to address that specific question, but there are really several different layers of data that will need to be looked at. For example, one of the data points that we're tracking, several data points that we're tracking on a daily basis are the number of dispatches. So when folks call 911, how many of those are for flu-related symptoms? We're tracking the number of influenza-like symptoms that are being reported by our paramedics and EMTs after they arrive on scene and assess those patients. So we're tracking all of that, and I think it all fits into the models to look at healthcare system utilization in general as to the trend of decreasing numbers of patients with potentially COVID-19.
Thank you.
Tom Davies, The Associated Press.
Good afternoon, Tom.
Hello, Governor. Dr. Box, has there been a change in the expected peak for most of the state? You were forecasting through mid-May for outside Indianapolis, and how does loosening the restrictions before then be considered? And then, Governor, I know in your call with Vice President today, some governors were saying they still need more help in providing adequate testing. Do you feel the same way, since experts have been saying that widespread testing, even more so than we have now, is needed for that reopening to happen?
So we will have more modeling data that they get together on Wednesday, and they'll show the governor and I that data Wednesday to Thursday. So we'll have a better look. Last week we saw some flattening in several areas. So like we had potentially reached a plateau. We still, unfortunately, have a lot of individuals out there that are at risk to be hospitalized just because they're our highest risk populations, and that would involve our long-term care facilities and our prisons and some other areas. So I'm not 100% convinced that we've reached that peak. I think that I'll be interested to see what our modeling shows this week. What it has shown is that consistently we are running much lower than the original projections, and that we are very much running along the lowest expected line as we model this and follow this out on a 72-hour period.
That's a credit to people in the state of Indiana practicing good physical distancing. You want to talk about the map of the labs spread out all over the state of Indiana? You touched on this earlier, right. But just for Tom's and his subscribers' benefit, how they're all different labs scattered all across the state of Indiana, how we're encouraging them all to increase testing.
Right. So the point is to not only identify where all the lab testing is available, but make sure that there is that site that an individual can go and actually have the lab done. And we know that there are those sites connected with some hospitals, connected with some community health clinics or FQHCs across the state. But I really need to have a handle on that and be able to map that out so that we can identify any gaps in that service across the state, because the reopening is going to require that we do have a site for an individual that's accessible to them to go and get tested, and for us to be able to get a turnaround. If they're sick, they have to go home and isolate no matter what it is anyway. So we don't have to have a 12 or 24-hour turnaround like we do in our long-term care facilities or our prisons, but we do want to get a reasonable turnaround so we can make sure we can contact trace and identify anybody else that could be getting sick.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. A lot of people covered some of the ground that I wanted to go, so I'll throw a quickie at Dr. Box here. Have we made any more progress on getting additional rapid testing machines that we are utilizing in these drive-through clinics? I know it sounded like a while back we had 5. We had maybe been promised more and never got them. Are we getting more? Are we able to roll more of those out, since those seem to be a really good way to process a lot of people quickly, which is, as other people have talked about, an area that we maybe want to go in order to better inform our ability to reopen and get back to business?
Great question. So we were promised 15. We did get 15, but the 5 is that we only got 5 cartridges, which allowed us to run tests on about 124 people. So as we were training people, for instance, we gave, I think, 3 maybe to the Department of Corrections, because we know that's a congregate setting where we have at-risk populations and we want to make sure we can test quickly. We did get some additional cassettes this past week, I think 15, which allows us to test about 360 people. But I would love to, and we've already applied to get more of those machines, but the cassettes right now seem to be the rate limiting step.
Our final question is from Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Hey, Governor. In terms of the new executive order, you talked about you're going to do this evaluation up through next Sunday ahead of potentially allowing elective surgeries on Monday. But the situation presumably won't be the same for every medical facility statewide. So how should a medical facility know when it alone can go ahead with some of these elective surgeries?
Yeah.
So I think that's an excellent question. Different regions of the state may be at different places with regards to the burden of number of patients that they have admitted and the amount of PPE that they're using, potentially even the medications that they would need to put someone to sleep or to do surgery. There are a number of ICU beds that are available. When we start doing things like elective hip replacements and knee replacements, that requires a lot of personal protective equipment. So the ability to know as a hospital system that you are well stocked with all of these things and that you safely can allow these other procedures to start happening is really, really critical, and not something that, you know, we want to direct 100% right now, but we do want them to be looking at that carefully. As we go forward, if we start to see a surge or if we let things up and see an increase again, it may be a time when they, as a team, as a hospital system or network, as a region, say, you know, we need to lock this back down for a little bit and then reopen it as needed.
Thank you for joining today's briefing. Governor Holcomb's next.
And you've been watching Governor Holcomb's update on Indiana's coronavirus response. The governor officially did extend the stay-at-home order until May 1st. The governor also said that elective procedures at hospitals will be allowed starting tomorrow at the doctor's discretion. And during the update, Governor Holcomb answered a question about protests held over the weekend. He said that he understands people's frustrations, but the protesters, he said, who are not practicing social distancing and wearing masks are not helping. We'll have a lot more for you tonight on CBS 4 News at 5 and 6 o'clock, and right now on the CBS 4 Indy News app.